Now, I should say that in Australia, the UK and Europe, we use the FDI, the Federal Dental International Tooth Numbering System, which essentially has every tooth with a number of 2 digits. For example, 18. For example, 37. And what do those numbers mean? Well, the first number refers to which corner of the mouth we're talking about. So we're looking at a patient face on. What we're seeing is the right-hand side of the patient and the left-hand side. So the upper right quadrant is quadrant 1. The upper left quadrant, quadrant 2, the lower left quadrant 3, the lower right quadrant 4. So every tooth in that quadrant will start with the number 3 or the number 2 or the number 1 or the number 4. So that's the first number. The second number refers to how far from the midline we are. So there is the midline. So we can always count back 8 teeth. Remember, 32 teeth, 8 teeth in every quadrant. 1, 2, 3, 4, 5, 7, 8, etc., etc. So 17 is on the upper right-hand side, the 7th tooth back. So this is the numbering system. In America, I think you number it from 1 to 32, where we start number 1 here, number 2, 3, 4, 5, up to 14, and then we come back to tooth number 3, 2 down here. But this is the system that we use in Australia and Europe and the UK. And these are traditional standard 2D X-rays. The red are referred to as bitewings, meaning literally you've bitten down on a little wing that holds the X-ray in place, and we can get upper and lower teeth and look at these surfaces, because I can look at the top of a tooth, I can look at the outside of a tooth, I can look at the inside of a tooth, but I can't see where the teeth touch, and that's often where decay creeps in. So they're called bitewings, and periapicals are, as the name implies, looking at the periapical, the tip of the apex of a tooth region. But there are even limitations with this kind of thing. In our practice, we would typically just take the bitewing X-rays, look at the OPGs. These are panoramic X-rays, and these are important because they're a great screening X-ray. Here's somebody who's hasn't got a big dental history, but they haven't had their wisdom tooth removed. They have no pain at all. I'm not too concerned about this wisdom tooth, or that looks pretty bad, but if it's not impacting on that, I could live with that or that. It's this one that's the problem, surprisingly. Look at this big shadow around the tooth. There is a huge cyst forming around this wisdom tooth, which without this type of X-ray I would never have known. And having removed the teeth, this was all allowed to heal, and we were fine. You wouldn't take one of these. I mean, this is a great screening X-ray, but maybe every 5 years or so, depending on the person's history. Someone like this, I probably wouldn't take another one for 10 years. But there are others, like this, which show us a lot more. We can see so much. The mandibular condyles. This is the mandible. This is the condyle that sits in the temporomandibular joint. You can see the difference in shape here. See how rounded that is? See how flat that is? So that's important. We can look at the teeth. You can already see, without much experience, a lot of white, which tells us there are fillings. You can see the dark shadows, which are the nerves in the teeth, but there are white filling in the nerves. These are root canal treatments. We are looking for infection at the tip of the root. You see how here in this tooth, this would be tooth number 4-2, lower right quadrant, second tooth back. There's no shadow at the tip of the root, and yet there's a shadow here. Here's a little root tip and a shadow, infection. Here's a shadow at the tip of that root, infection. Here, this tooth is almost swimming in infection. And here we can see a cavity in the tooth. So we can get a lot of information from this. It's a great screening. I would definitely be sending this patient off for a 3D X-ray. But you can see a lot on a 2D X-ray.